How to Stop Motion Sickness Instantly. Doctor's Travel Guide. What if you could completely stop that sudden wave of cold sweat, dizziness, and intense nausea before it completely ruins your next family road trip, flight, or dream cruise? Almost everyone has been there at some point in their lives, or has had to watch a loved one suffer through it. You are sitting in the back seat of a car, or perhaps looking down at your phone for just a split second, and suddenly, your stomach takes a terrifying drop. In my years of clinical practice, I have treated hundreds of travelers who are absolutely terrified of leaving their comfort zones because of this exact issue. Today, we are going to look past the common myths and get straight to the science of what is actually happening inside your body. We are going to explore why your brain goes into crisis mode, look at the absolute best motion sickness remedies, and discuss how to fix motion sickness so you can finally travel with confidence. If you are tired of having your vacations ruined by the constant dread of feeling ill, you are in the exact right place. Hello and welcome. I'm Dr. Matthew Harrison. On this channel, we break down complex medical topics into simple, actionable daily wellness steps so you can live a healthier, happier life. If you believe that traveling without physical limits is a vital part of a happy lifestyle, please take a quick moment to subscribe to our channel and hit that notification bell. By joining our community today, you ensure that you never miss a critical health guide while helping us share these essential wellness resources with millions of others who are silently struggling to find relief. To understand travel sickness and find an effective motion sickness treatment, we first have to explore the fascinating biology of why this happens. What are the actual motion sickness causes? Biologically speaking, motion sickness is not a disease or a sign of a weak stomach. It is actually a temporary communication breakdown between your brain and your sensory organs. Your brain relies on three separate systems to figure out where you are in space: your eyes, which see where you are going; your deep tissue receptors, which feel the physical movement; and the vestibular system in your inner ear, which acts as your body's internal gyroscope, sensing balance and direction. When you are walking on solid ground, all three systems are in perfect harmony. But let us say you are experiencing car sickness. If you are sitting in the back seat of a moving vehicle and looking at a book or a screen, your eyes tell your brain that you are completely still. However, the fluid in your inner ears is sloshing around from the turns, bumps, and acceleration of the car, sending a strong signal that you are moving very fast. This massive sensory conflict confuses your brain. In an evolutionary sense, your brain does not understand modern transportation. When it receives conflicting messages from your eyes and your ears, its survival mechanism assumes you have ingested a toxic neurotoxin or poison. To protect you, the brain triggers a chemical response that can rapidly lead to dizziness, cold sweats, hyperventilation, and eventually, the ultimate defense mechanism, vomiting. It is a highly sophisticated system designed to keep you alive, operating in a modern world that it does not quite comprehend. If you have ever had your travel plans completely derailed by these uncomfortable physical symptoms, please take a quick second to hit that like button to support our channel. If you feel comfortable, please drop a comment below and share your worst experience with travel sickness, or ask any questions you have about managing your symptoms. Also, if you know a friend or family member who refuses to go on road trips because they are terrified of getting sick, please share this video with them. Spreading health and travel education is a collective effort, and your simple share could help someone finally enjoy their next vacation. Now let us discuss the practical, actionable ways to manage this issue, starting with how to get rid of motion sickness in car rides, which is the most common place people suffer. If you are a passenger, the absolute best way to align your senses is to sit in the front seat and look directly at the horizon. By looking out the front windshield at a fixed point far away, your eyes and your inner ears will finally agree that you are moving. This simple adjustment is incredibly effective for reducing sensory conflict. Additionally, try to avoid reading, looking at your phone, or sitting facing backward on trains or buses. Keeping a cool breeze of fresh air blowing directly onto your face from the car's air conditioning vents can also help soothe your autonomic nervous system and keep nausea at bay. When we look at how to prevent travel sickness during longer journeys, such as flights or ocean cruises, preparation is absolutely key. For wellness travel, planning your position on the vehicle can make a world of difference. If you are flying, request a seat directly over the wings, where the aircraft is most stable. If you are going on a cruise, book a cabin in the middle of the ship and coast to the water level, which experiences the least amount of rocking. Furthermore, your pre-travel habits play a massive role in your comfort. Avoid heavy, greasy, or acidic meals before you depart, as they make your stomach far more susceptible to irritation. Instead, opt for small, dry, bland snacks like crackers. Staying well hydrated is also critical, but you should strictly avoid alcohol and caffeine, as they can worsen dizziness and dehydration. This brings us to a question I get asked constantly in my clinic. Do motion sickness bands work? These are elastic wristbands that apply gentle pressure to a specific point on your inner wrist, known in traditional medicine as the P6 or Naguan acupressure point. From a modern scientific perspective, studies on acupressure bands show mixed results. Some clinical trials suggest they can provide meaningful relief by stimulating the median nerve and sending calming signals to the brain, while other studies suggest the benefit is largely due to the placebo effect. As a medical professional, my advice is simple. Because these bands are completely safe, inexpensive, and have absolutely no side effects, they are certainly worth trying as a supplementary tool for your travel tips toolkit. If you are looking for highly effective home remedies, nature has provided some outstanding options. For centuries, ginger has been utilized as a powerful natural remedy for gastrointestinal distress. Clinical research shows that active compounds in ginger, such as gingerols, can help calm the stomach wall and block the brain receptors that trigger the urge to vomit. Taking ginger capsules, chewing on raw ginger, or drinking high-quality ginger tea before and during your trip is one of the most reliable home remedies available. Peppermint is another fantastic option. Inhaling peppermint essential oil or sucking on a peppermint lozenge can relax your gastric muscles and provide a soothing distraction for your senses. However, if natural remedies are not enough, we must look at medical motion sickness treatment options. For mild to moderate cases, over-the-counter antihistamines are highly effective. Medications like dimenhydrinate, commonly known as Dramamine, or meclizine, work by dulling the balance signals sent from your inner ear to your brain, effectively silencing the sensory conflict. The most important thing to remember is that these medications must be taken at least 30 to 60 minutes before you start traveling. If you wait until you are already feeling nauseous, the medication will be far less effective because your digestive system has already slowed down. Keep in mind that these medications can cause significant drowsiness, so you should never drive or operate heavy machinery while using them. For severe, long-lasting travel sickness, such as a multi-day cruise, your doctor can prescribe a scopolamine patch. This is a tiny, clear patch that you apply behind your ear at least 4 hours before your journey begins. It slowly releases medication through your skin, blocking the chemical transmitters in your brain that trigger motion-induced nausea. While incredibly effective, scopolamine can cause side effects like a dry mouth, mild sleepiness, and blurred vision. So it is important to discuss these options with your primary care provider. As we look at the big picture of health and travel, it is important to remember that motion sickness is a highly manageable condition. You do not have to let the fear of physical discomfort dictate your boundaries or prevent you from exploring the world. By understanding your body's natural alarm systems, making a few simple adjustments to your environment, and utilizing the right remedies or medical treatments, you can keep your sensory systems in harmony and focus on enjoying the journey. If this guide has helped you understand the biology of motion sickness and has given you a clear, actionable plan to travel comfortably, please support our mission by subscribing to the channel. Don't forget to like this video, leave a comment sharing which strategy you plan to use on your next trip, and share these wellness travel tips with your loved ones. Your engagement helps us continue to provide high-quality, evidence-based medical advice to travelers around the globe. Thank you so much for watching. I'm Dr. Matthew Harrison. Safe travels. Take care of your body. Be kind to your mind. And I will see you in our next video.